Scapolohumeral rhythm. The scapolohumeral rhythm is a regular pattern of scapular rotation that accompanies and facilitates humeral abduction. The full range of shoulder motion is combination between the motion in glenohumeral and scapulothoracic joint. During 180-degree abduction, there is roughly a 2:1 ratio of movement of humerus to scapula, with 120 degrees of movement occurring at glenohumeral joint and 60 degrees at the scapulothoracic joint. Glenohumeral rhythm has three phases. Phase 1. In the first phase of 30 degrees elevation through abduction, the scapula is said to be setting. This setting phase means that the scapula may rotate slightly in and slightly out, or don't move at all. Thus, there is no 2:1 ratio of movement during this phase. The angle between the scapular spine and clavicle may also increase up to 5 degrees by elevating at the sternoclavicular and acromioclavicular joint. The phase 2. During the next 60 degrees of elevation, the scapula rotates about 20 degrees and humerus elevates 40 degrees with minimal protraction or elevation of scapula. Thus, there is 2:1 ratio of scapolohumeral rhythm. During second and third phase, the rotation of scapula total of 60 degrees is possible because there is 20 degrees of motion at the acromioclavicular joint and 40 degrees at sternoclavicular joint. The phase 3. During the final 90 degrees of motion, there continues to be a 2:1 ratio of scapolohumeral movement and the angle between scapular spine and clavicle increases an additional of 10 degrees and becomes 15 degrees. During this final stage, the humerus laterally rotates about 90 degrees so that the greater tuberosity of humerus avoids acromion. In phase 1, at humerus there is 30 degrees of abduction, at scapula there is setting phase, at clavicle there is 0 to 5 degrees of elevation. In phase 2, at humerus there is 40 degrees of abduction, at scapula 20 degree rotation, minimal protraction or elevation, at clavicle 15 degrees elevation. Now phase 3, at humerus 60 degrees abduction and 90 degrees of lateral rotation, at scapula 30 degrees rotation and at clavicle 30 to 50 degrees posterior rotation and up to 15 degrees elevation. Now the causes of abnormal scapolohumeral rhythm: fracture of clavicle, spinal accessory nerve palsy, weakness of serratus anterior muscle which may cause winging of scapula, rotator cuff muscle weakness, acromioclavicular joint arthritis, and glenohumeral joint degeneration.